Okay, in this video I'm going to be showing you how to give an IM injection in the deltoid, and I'm also going to be giving an IV push. So before I get started, I'm going to go ahead and verbalize my 3 medication checks. I'll check the medication in the drawer before I take the medication out of the drawer. I'll take the medication out of the drawer and compare the medication to the MAR at the cart. I would then check my medication in the patient's room, and that's my 3rd med check, checking the medication against the patient to ensure that I'm giving the right medication. When I'm checking the medication in the client, I'm checking to make sure that I have the right medication, I'm giving it to the right client, it's the right dose, I'm giving it for the right reason, I'm giving it at the right time, and that I document this. So those are my medication checks, and then I would then put these aside because I've checked my physician's orders. So when I check my physician's orders, I would check my physician's orders, I would wash my hands between each medication preparation, I would identify my client by 2 methods, I would provide my policy and pull the curtain, and I would assess my patient for any allergies or anything like that, and I would also assess my patient for any incompatibilities with the medications that I'm administering. So to get started, the first medication that I'm given is Toradol 1 milliliter in the deltoid. So I'm available Toradol 30 milligrams per milliliter, and I was ordered Toradol 30 milligrams. So I'm going to draw 1 milliliter of medication into my syringe to be administered IM into the deltoid, and it is a medication, it's an anti-inflammatory, and it's used short-term to treat moderate to severe pain. And I would be sure that I also label my syringes, and I'm going to get started now. So I'm going to put on my gloves. I'm going to put on my gloves, and before I do anything, I'm going to make sure that I swab this bottle because it's a multi-dose bottle. I'm going to swab this and discard that. And then I'm going to open my syringe. I'm going to attach my draw needle. So when I attach my draw needle, I'm going to maintain sterility, and I'm going to go straight on, screw on, and I'm attached. Now I can discard this. I'm going to lay the top down on the medication cart. I'm going to pull back 1 milliliter of air because I'm giving a 1 milliliter injection. And I'm going to insert 1 milliliter of air. I'm going to pull back 1 milliliter of medication. And I have air, so now I'm going to get the air out of my medication. And I am going to show you that I have 1 milliliter of medication. So, my 1 milliliter of Toradol is ready to be injected, so I'm going to 1 scoop the method, and I'm going to discard the draw needle. I'm going to attach the needle that I'm going to administer the medication with, and I'm going to label it Toradol 1 milliliter IM injection. And I'm going to lay this medication on the cart because it's sterile. And the needle that I used was a 25 gauge and a 1-inch needle because I'm going into the deltoid. And I can discard that. That was my medication preparation for the Toradol. And now I'm going to prepare my medication to give an IV push. So I'm going to take these gloves off, discard them. I'm going to wash my hands and get back at the cart and put on a clean pair of gloves. Okay, now that I'm ready, I have a new clean pair of gloves on. I'm going to take my next medication, Zofran, which I'm going to be giving IV push. I'm going to swab my port, and for Zofran, I'm going to make sure that anything I have infusing isn't anything that has alkaline solutions in it because that's incompatible. But today I have D5 1.5 normal saline solution. So I'm good, and my medication is compatible with what's infusing today. So I've swabbed the port, and then I'm going to open up my 3 milliliter syringe, and I'm available 4 milligrams, and this vial is 4 milligrams per 2 milliliters, so I'm going to be infusing 2 milliliters through IV push over 15 minutes, and when we do 15-second intervals, I would give 0.1 push over 15 seconds into the IV push. So I've opened up my 3 milliliter syringe. I'm going to open up my draw needle. I'm going to attach them, discard, and same thing here. I'm going to take the top off, lay it down. I'm going to pull back 2 milliliters of air and insert this 2 milliliters of air into the vial. So I'm going to hold this, insert 2 milliliters of air, and I'm going to pull back 2 milliliters, 2 milliliters. I'm going to pull back a little bit extra. I'm going to pull back a little bit extra to ensure I get medication. Discard. Now I'm going to go to the trash can or the sink and ensure that I have 2 milliliters in my tube. I'm going to scoop the top, take the draw needle off, and I would put a sterile cap on this, and I'm going to label it Zofran 2 milliliter injections, and I'm going to push 0.1 in 15-second intervals over 15 minutes. So now my medications are prepared, and for the IV push, I have a 10 milliliter syringe of sterile normal saline. I have alcohol preps ready. I'm going to discard these gloves, wash my hands, and I'm going to enter the patient's room. Sierra. And now I'm going to enter the patient's room. Knock, knock, knock. Good morning, I'm Shelby. I'm going to be your student nurse today, and I'm going to be administering an IM injection and an IV push this morning. So I've already done my 3 med checks, and I've already done CYPA, but if I needed to do it again, I would check my physician's orders before I entered. I would wash my hands, provide my privacy, identify my client by 2 methods, and ask him if he had any allergies that you have, and ensure that what I had infusing was compatible solutions for my medications. So I'm going to put on a new pair of gloves. I wouldn't drop it. Put on a new pair of gloves, clean pair, and I'm going to insert the IM injection first. So for my IM injection, I'm going to get the injection, I'm going to swab it. I'm giving the IM injection in the deltoid, 2 fingers breadth below the acromion process and 1 hand's breadth above the elbow, and I'm going to use the inner and outer as my boundaries, and I'm going to go right into the deltoid. So I'm going to clean, bullseye motion, inner to outer, discard in the biohazard bag. I'm going to move my biohazard bag closer so I don't have to cross over. And when I inject the IM medication, I'm going to go straight in at a 90-degree angle, stabilize, inject, aspirate, pull out, and we're done. So I'm going to inject this into your deltoid, 2 fingers down, hands breadth above, inner and outer. I'm going to go in at a 90-degree angle, stabilize, push medication, aspirate, I'm not in a vessel, pull out, immediately into the sharps, and that is your IM injection. And I could put a Band-Aid on it, but he shouldn't bleed. And I would document the IM injection that I inserted at 90 degrees, the patient tolerated medication, and there wasn't any allergic reactions. Now, for the IV push, I'm going to pause the pump and kink my tube. So I'm going to kink the tube while the pump is paused. I'm going to have my 10 milliliter syringe and my medication in my hand. I'm going to take the sterile top off of the saline tube, and I would have a top on my medication. I would take that off also. I'm going to swab the port before I touch it with anything. Discard. And this is sterile. I just took the top off. I'm going to secure it onto the tube and inject 5 milliliter flush to begin with. And you should have 5 milliliters left over to flush afterwards. I'm then going to swab my port again, discard, inject my medication, connect my medication, and I'm going to push 2 milliliters over 15 minutes or 0.1 milliliters every 15-second intervals. So for video purposes, I'm just going to push because I don't have time for that. I'm going to discard, fire hazard. I'm then going to clean again. Discard. And I'm going to flush with the last 5 milliliters of saline in this tube. I'll take this off, discard it, and just to be safe, after I'm done, I'm going to clean the port one more time. Clean the port one more time. Unkink the tube. Unkink it. Unpause the pump. And clean up all my biohazard material. Take my gloves off. Wash my hands. And I would document that I gave a IM injection and an IV push. I would document any abnormalities to the doctor. I would ensure client safety. Bed is in a low lock position, bed rails up, and that my client didn't need anything else, and that he tolerated both medications. And for the Zofran, some contingencies would be, before you gave it, you would check their heart rate, you would check their respirations, because you're giving Zofran to relieve nausea and vomiting, so we could come back and assess the patient to see if the medication has started working. And I would document all of that, report any abnormalities to the doctor, and that is the IM and the IV push.